Hi everyone. So we're just going to do a scenario for you. Just going to do a scenario overview or a run through. I am at home, so I don't have a hell of a lot of equipment, but we've got a little bit. I've got Charlotte, who's going to be my partner.
Yeah.
I've got Kitty, who's going to be my imaginary bystander, and Billy's my patient. George is doing the recording. Okay. So the job that we've been given is a 10-year-old male who's fallen from the roof about 5 metres through the roof. He's gone from the tiles through the roof and is now lying on the floor, not moving a great deal. So that's our job. So we're going to enter over through there. So basically, to start with, before I come onto scene, I make sure that I'm wearing the appropriate safety gear. As you can see, I have my safety shorts on. I've taken my safety thongs off because it's rude to wear your thongs inside. My partner has her safety tracksuit on because it's Friday night and she hasn't bothered changing from a uniform. But we would have all our safety gear on. We'd have gloves and glasses on as well. We're checking for hazards as we come through, and I ask, are there any hazards? And I'd be told there are none. I'll also be asking for the number of patients, and I'd be told there's only one as well. Also check for the mechanism of injury, and I'd be told that the patient has fallen from the roof through the ground. So before I go any further, I'm going to give an ethane report. Get on to control. We're at 123 Awesome Street, Awesomeville, where we come to a 10-year-old male who has fallen through the roof about 5 metres. No perceived hazards. Access is through the back door. There's only one patient, and I'd like backup of the highest clinical level. And in asking that, I'd be told, can I please give an IMIST report for the backup as soon as possible? To which I'd say, yes, I will. So coming into my patient, and I turn around and say, g'day mate, can you hear me? My name's Tony, what's happened?
I've fallen through the roof.
Okay, no worries at all. Where does it hurt, mate?
My hip.
Okay, so basically in doing that, I've assessed that he actually has an airway. Is there any catastrophic hemorrhage? I'll be told no, there's not. Are there any obvious injuries? And I'll also be told in this instant that no, there's not as well. So what I'll get you to do is just pop your stuff over there, partner, on the table there. And because I'm going to use Nexus as my guideline, but because of the mechanism of injury, and we're going to call his hip a distracting injury, I'm going to get you to take manual inline stabilisation, if that's okay.
Okay.
Awesome. As she sighs to do it. She's not a teenager. Right. So I'm going to come down and just do a couple of further inspections. So I've already assessed his airway is open because he's responded to me. I've assessed him as alert because he was able to answer my questions. I'm looking at his breathing rate, and his breathing rate is quite normal. It's not fast or slow. I'm going to oscillate in 2 places, and that's equal. I'm going to feel his pulse in this arm, and that's quite normal. I'm going to check capillary refill on that side, and feel his temperature as well. Capillary refill is less than 2 seconds. Temperature's normal. Primary survey done. So I'm now going to come through and do a rapid trauma survey. So I'm just going to feel around. Does that hurt at all when I do any of that? No? Excellent. I'm going to look at his neck for jugular vein distension or tracheal deviation, which I can't see either. I would lift his shirt up and I would inspect his chest. I am inspecting, I can't see anything. I am going to oscillate this time in 4 places. And it's still quite equal. I'm going to palpate his abdo twice. That doesn't cause him any distress, but when I touch his hip, he goes,
ow.
Okay, so I realise, ow, it hurts. Just going to feel down your legs, mate. Does this hurt at all?
No.
Feel down this leg. Push up against my hand. Push up against my hand. Do your arms hurt at all?
No.
Take my hands, squeeze them, pull me towards you. Okay, no worries, stop there, mate. Okay, so, partner, what I feel is we need to pop a collar on him. I think we need to pop a pelvic binder on him as well.
Yep.
We'll do the collar first, and I'll get you to stay there and help me.
Yeah.
Then I'll give him some pain relief. I'll do a OPQ-OST and a sample before we do that. We'll put a pelvic binder on him, and then I'll go through and do another survey. Does that sound okay to you?
Yep.
Excellent. So I'm just going to get my gear. So collar to start with. I'm just going to measure you up. use my two, 1.5 to 2 fingers. So I've got you there. So I'm just going to pop this underneath your head, nice and still. We've got the collar fitted. Is that all right?
Yeah.
Okay. So I've got the collar fitted. Now what I'm going to do, I'd like to give you some pain relief because you do feel as though you're in pain. But before I do that, can I get the imaginary partner to come and take hold of the head for me? Partner, can I get you to take a blood pressure, a respiratory rate, and a heart rate for me, please?
Yes.
Excellent. Okay. So, I'm getting some signs and symptoms done now, although I do know that you have pain in your hip. Okay. Are you allergic to anything?
No.
You're allergic to penicillin? Okay. Do you take any medications? You take Ventolin. Okay. And is that for your asthma?
Yeah.
Yes, it is. Okay, excellent. When was the last time you had something to eat, mate?
This morning.
This morning? You didn't have dinner a minute ago, Sydney? Okay, we go this morning, that's fine. When was the last time you went to the toilet?
2 hours ago.
Okay, excellent. And just to confirm, you were up on the roof,
Yeah.
playing football on the roof.
No.
You trod on the wrong bit and you've fallen right through the roof and you landed down here, and that's what happened?
Yeah.
Excellent, no worries at all. So that's when the pain happened, you weren't sore before you fell?
No.
Okay. And the pain, what makes it better and what makes it worse?
When I have my legs.
When you move, it makes it worse, but when you stay there, it's better?
Yeah.
Okay. Would you call it a sharp pain?
Sort of.
Okay. And when you move, does the pain go anywhere else or does it just stay around your hip?
Just stay around my hip.
Okay. If I said 0 was nothing and 10 was the worst amount of pain you've ever felt in your life, what number would you give for the pain?
4 and 5.
7 or 8?
Yeah.
8? Let's go with 8 out of 10. Okay. And this did start as soon as you fell from the ground. There was nothing else happening prior to that?
Yeah.
Okay. Excellent. No worries at all. So basically we've got a pretty cool idea of what's going on. I'm just coming over to grab my methoxy so I can come back and give it to him. Before I do that, my partner's taking some obs for me to help me out, which is going very, very well. And I just need to check a couple of things of you. So, have you ever had any pain medication, any anaesthetics before?
No.
No, you haven't. You're greater than 1 year old. Have you ever heard of something called malignant hypothermia?
No.
Okay, excellent. And do you have any kidney or liver problems?
No.
No. Okay. So what I'm going to do is, I've got it already, my methoxy whistle. So I'm going to get my methoxy together. I'm going to give you this medication. It's called methoxy. I'm going to get you to breathe it in and out in through your mouth and out through your nose. Okay? A little bit of a strong smell, but it works quite well. So what I'm going to do, partner, is I'm just going to get you to cross-check for me. Can you check that says methoxyfluoride and the expiry date is June 2021?
Yeah.
Excellent. Okay. So just going through my 5 R's, this is the right drug, the right patient is patient in pain, the right place is right now, the right route is in hard, the right time is now because he's in pain also. Right patient, right route, right dose, right time. We're good. Righto. So Billy's going to have that. Now, what we're going to do is we're going to pop on the pelvic binder. Ready to help, Charlie?
Yeah.
So first of all, I'll get you to pull that out. I'm just going to traction your legs in like that. Pull that out for us. Excellent. Good job. So we'll just get that. We'll just leave that line. I'm just going to use you as a bit of a workbench there, mate. Is that okay? And we're going to pop a belt on you just to make you feel a little bit better. So pull that through your knees. Pull through. Okay, and then up. Okay, pull it. You might not be able to sit down the whole time, Charlie. Pull. Pull. Okay. Okay. Now, put this around his knees. Right, can you tie that up for me? Put this one around his legs. Alright, now Charlie, what I'm going to get you to do is I'm going to get you to get the monitor, the life pack, and pop on a 4 lead. I'll get you to put the oxygen saturation monitor on as well. I want a blood pressure every 5 minutes. I'd like you to take his blood sugar, his temperature as well. Already assessed his GCS as 15. If I can think of anything else on the way through, I'll get you to do that as well. Is that okay?
Okay.
Okay. Bill, do you feel any better, any worse, or the same?
About.
About the same?
Yeah.
Okay, no worries at all. So what I'm going to do now is I'm just going to go through and take a bit more of a thorough investigation. I just need a pen torch. The Foxy whistle's changed from a pen torch. Okay, and you've been jiggling around there, haven't you? Alright, so basically I'm just going to feel around your head and I'm looking for deformities, contusions, abrasions, penetrations, burns, lacerations, swelling, tenderness, instability or crepitus around your head to start with. Do you feel any of that?
No.
Excellent. I don't feel any of that either. Okay, I'm looking at your ears for any discharge. I can't see any. I'm looking behind his ears for any battle scars, which again I can't see. I'm looking for raccoon eyes as well. Hasn't got any of that. Just going to check your pupils. Going to shine a torch into your eyes. Look at my nose. So I'm looking for equalness, reactivity, and accommodation, and that all looks quite good. I can look through the collar and I can see his neck. There's no jugular vein distension. There's no tracheal deviation, which is also amazing as well. Although he has managed to wiggle himself around into a very crooked position, which hasn't been great. Anyway, so again, I would have exposed his chest. Oh, I'll get my stethoscope. His chest would be exposed, and I'm looking for, in his neck, I was also looking for decap BLS tick. I'm looking for that in the chest also. And then, Charlie, I'm going to auscultate in 6 places. Now, I don't think feel anything abnormal, but if I did, I'll then percuss in the same spots. And again, because he's giggling, we reckon we're pretty good, don't we? All right, cool. So, looking in the abdo, I'd also auscultate the apex beat, and I can actually hear that. And now I've still got this in, I'm going to go and do a NIPA assessment on his abdo, but I'm going to auscultate first. Inspect for decap BLS tip. I'm going to palpate, and I'm not palpating hard because he's just going to giggle. So I won't go any too hard. Now, I'm not going to bother percussing, but if I did percuss, I would just do that again. That's why I wasn't going to bother. Alright, I'm not going to inspect his pelvis because I've already dealt with that, so I'm not going to play around with that anymore. Any pain in your legs at all, mate?
No.
So you can actually palpate the whole way down the bone, there, and feel if there's any pain. And there's none. Push against my hands, and feel for pedal pulses, and capillary refill, and you need a shower. Alright, squeeze my hands, pull the movement towards you, push me away. Okay, so there's no pain in his arms. In doing those assessments, I can tell that his shoulders are pretty cool as well. So basically, I've gone through. What would you give your pain out of 10 now, mate?
About 2.
Excellent, no worries at all. So now I've just been waiting for backup to take us up to hospital. We've done all our, to help us extricate and go up to hospital. We've done all my extrications. You've got 20 minutes for your scenario. Now would be a really cool time to just get your head together and get ready for your handover. So I'm going to do that very shortly. And come on, Kitty, you can be my nurse.
Tiny nurse.
So basically, Kitty now the nurse, and my patient is here at hospital. And so basically, I need to give a handover now. So this is Billy, 10-year-old male, who's fallen from the roof about 6 metres to the ground. He's landed on his back. He's complained of pain in his pelvis. So we've splintered that. We put a collar on because of the mechanism and the distracting injury. We're giving him 3 mils of methoxy. He's taken his pain down from a 7 to a 2 out of 10. All his knobs have been within normal ranges. For example, his blood pressure is 160, his heart rate's 110, and he's been saturating at 97%. And it's been monitored in a sinus rhythm the whole way. He's allergic to penicillin. He takes Ventolin for his asthma, and his parents are about 5 minutes away from the hospital.
Yep.
And that's it.